Medicare coverage ends in 100 days. After that, $800 per day. Let that number sink in for a moment. $800 every single day. That's $24,000 a month, $288,000 a year. For one person, your mother, your father, the person who raised you, who worked their entire life, who saved what they could. And now, you're standing in a hospital hallway, holding paperwork you don't understand, making decisions you're not prepared for, about money you don't have. If you're in your 50s or 60s, this isn't a distant possibility. This is your future knocking on the door. And most of us, we're not ready. This is not another retirement planning video. This is about the conversation nobody wants to have until it's too late. The one that happens in emergency rooms, nursing home offices, and sleepless nights when the bills pile up and you realize love isn't enough. So let me tell you some stories. Real stories. From real people. Who discovered too late that caring for aging parents doesn't just cost money. It usually starts with a phone call. For Sarah, it came at 3 a.m. Her mother had fallen. Not a bad fall, just a slip. But at 78, even small falls reveal bigger truths. Sarah called it the beginning of the end of normal. By September, her mother couldn't live alone. The choices were stark and expensive. Hire a private caregiver, move her to a facility, or move in. Private caregiver, $20 to $30 per hour. For 24-hour care, that's $14,000 to $21,000 per month. Assisted living, starting at $4,500 per month. Memory care for Alzheimer's, $6,000 to $10,000 per month. In major cities, nursing homes can hit $15,000. Medicare covers 100 days in a skilled nursing facility. What they don't tell you clearly is what happens on day 101. Medicare stops. Completely. Sarah did the math in the hospital parking lot. $24,000 per month. Her mother's total income was $2,400. The gap? $21,600. Every month. Sarah is part of the sandwich generation. People in their 50s and 60s caught between supporting children and caretaking for aging parents. Michael, at 58, is raising 2 teenagers while managing his mother's Alzheimer's. He and his wife both work full-time, and still, it's not enough. Michael spends 2 hours every day on his mom's needs. Doctor appointments, medications, making sure she's eating, making sure she's clean. Michael's mother worked as a cleaning lady for 25 years. She saved what she could. Now the cost of her care exceeds everything she earned. According to AARP, family caregivers spend an average of $7,200 per year of their own money. For intensive care, it can be $50,000. Mistake number 1, assuming they have a plan. Janet assumed her parents had everything figured out. They were smart, professional people. When her mother had a stroke, Janet couldn't access bank accounts. She couldn't make medical decisions. She couldn't pay the bills. Without legal documents, Janet had to go to court for guardianship. It cost $8,000 in legal fees and 6 weeks of nightmare. Mistake number 2, waiting until crisis hits. David's father was a Navy veteran. He never wanted to be a burden, so he never asked. By the time he needed care, long-term care insurance was unavailable. The window had closed. Waiting cost them everything. Mistake number 3, underestimating scammers. Margaret's mother gets 15 calls a day. Scammers pretending to be the IRS or Medicare. Mistake number 4, not having legal documents. You need power of attorney, healthcare proxy, and living will now, not later. Aging has 3 stages: go-go, slow-go, and no-go. The tragedy is that most families don't plan for stage 3 until they are in it. This costs your career, your relationships, and your health. One caregiver said, "I'm forgetting to keep myself alive." That's the real cost, the feeling that you sacrificed everything, and it still wasn't enough. Start the conversation today. Here's something most people never consider until it's too late. Where your parents live can mean the difference between manageable and catastrophic costs. Let me give you some real numbers from 2026. Nursing home costs vary wildly. Alaska is nearly $30,000 a month, while Mississippi is under $5,000. Meet Richard and Martha. They spent 30 years in South Florida, loving the beach and the sun. But as they aged, the climate and costs changed. Hurricanes brought rising insurance premiums, and Richard's minor stroke made them realize their two-story home and distant hospitals were becoming major liabilities. They moved to South Carolina. They saved $16,000 a year on insurance and reduced their potential nursing home costs by over $3,000 monthly. Crucially, they moved during the sweet spot between ages 55 and 65, while they still had the health and energy to manage the transition. I knew a man who waited until retirement to hike the Appalachian Trail. By 64, severe arthritis hit. He never made it to the trail. When relocating, check healthcare proximity first. Is there a stroke center within 15 minutes? Are there specialists nearby? Paramedic response times matter immensely. Now let's talk about the Medicaid trap. Medicare covers doctor visits, but it does not cover long-term nursing home care. Most families are caught off guard. Medicaid kicks in only after you've spent down almost all your assets, often leaving you with less than $2,000. You must become poor. The 5-year look-back rule means any gifts or transfers made in the last 60 months can trigger a massive penalty, delaying your coverage for months. The Johnsons tried to protect their home by transferring it to their kids, but they triggered a 29-month penalty, creating a $250,000 crisis. There are legal ways to protect assets, like the Medicaid Asset Protection Trust, but these require planning at least 5 years in advance. Then there are the invisible elderly, like 84-year-old Harold, who drives for Uber because his wife's dementia care drained every penny of their savings. Or Margaret, 82, substitute teaching just to afford groceries. She was a nurse for 40 years, but life's emergencies forced her to drain her 401k. To avoid this, you must do 5 things. First, have the conversation today. Ask your parents about their will, power of attorney, and healthcare wishes. Second, get the legal documents. You need a power of attorney, a healthcare proxy, and a living will. Do this for yourself too. Third, run the numbers. Calculate the actual cost of nursing homes in your city. Fourth, consider long-term care insurance while you are still healthy. Finally, plan your own future differently. Don't put your children through a crisis. Build a plan that doesn't assume everything will just work out. This isn't just about money, it's about love and dignity. Please, have the conversation today. Don't let a 3 a.m. phone call find you unprepared.